For now, though, I do want to thank everyone locally to date who has been involved moving quickly on this. Your help has been greatly appreciated. We have been thrown curveballs before in outbreaks, and this is one where a strong local approach will make all of the difference. So again, my huge thanks to everyone in the region who's been supporting the response, which includes our public health team in the Waikato and the Auckland area. Now, I'll come back to our status more generally. We're now 1 month and 4 days in from when we learned of the first case in this outbreak. We now know Delta has been present in the community for a week to 10 days prior to that first case, and multiple chains of transmission were already established. With Delta, we knew we couldn't take chances, and the immediate move to level 4, initially to understand the breadth of the outbreak, and then to get it under control, was the right move and has worked. Modelers tell us that had we waited just 1 more week to act, we would be sitting at around 5,000 cases by now. So to everyone, but especially Auckland, thank you for acting quickly and for persevering. We know that level 4 has been tough, but we also know it's made a difference. Since the outbreak began, we've identified 39,637 contacts, carried out almost 670,000 tests, administered 1.43 million first doses of the vaccine, and provided a further 660,000 people with their second dose. Almost all cases in the last 14 days have been household or known contacts of existing cases. And we are confident, as has been conveyed to us from the local public health team, that there is no significant undetected transmission. But Delta does have a long, hard tail to it. And the question we discussed as a cabinet today was, what is the best alert level we can use now to continue stamping out cases? In considering this decision, we looked at the details behind recent cases, and here are some observations. For the most part, we haven't had widespread issues with workplaces. Where we have had cases at work sites, these have generally been close contacts of existing clusters who have then gone on to infect work colleagues before they were a known contact. Workplaces, for the most part, had strict protocols in place and have moved quickly when cases were identified within their worksite. This tells that this approach remains really important going forward. Another important observation is that of the cases where we've been able to establish a link, none have resulted from people accessing essential services. This tells us that infection prevention controls like masks, distancing, and limited travel have all been incredibly important and must continue to be used. And what everyone will have observed is the final point, that where we have had cases, they have been dominated by close contacts, mainly household contacts, and in some cases, secondary households with other family members. That is why the next stage of our plan must continue to be to keep bubbles tight. This is key. And all of these features are part of level 3. These observations taken together has helped inform the advice of the Director General and Cabinet's decision today. That advice explicitly stated that level 4 has done what we needed it to do. It has helped us contain the outbreak. And now as we continue our zero tolerance approach to cases, level 3 still provides the really important and strict rules that help us keep up that important work. Therefore, we have accepted the Director General of Health's advice and confirmed that Auckland will move to alert level 3 at 11:59 p.m. tomorrow night, Tuesday the 21st of September. The Director General was also clear that given the long, hard tail of Delta, we will need time here. And Cabinet has accepted his advice for Auckland to stay at level 3 for at least 2 weeks, with Cabinet first reviewing those settings on Monday the 4th of October. As for the rest of New Zealand, as I outlined on Thursday last week, for so long as Auckland is at the higher alert levels of 3 or 4, a greater level of preparedness is needed elsewhere. In other words, level 2. You will have heard me signal last week, though, a view that with Auckland's move, there is an ability to allow one more minor change for the rest of the country, around the number of people who can gather together at level 2, including in hospitality venues, from 50 to 100, and Cabinet has confirmed that decision today. In terms of what level 3 means for Auckland, I can sum it up with one word: caution. You will have heard me say that when analysing where transmission has occurred, there are some strong themes, and reasons why certain rules remain in place. They stop transmission at level 4 and are still in place at level 3. First, your bubbles remain. You are not allowed to visit friends or neighbours at level 3. You shouldn't join them for food, talk closely across the fence, or even have children play together. I know this is strict and it is hard, but it is there for a reason. You are allowed to make very minor and small extensions to your bubble to bring in a person who may be isolated and vulnerable, such as an elderly relative. If you have care needs for children or the vulnerable, you may bring in another family member or carer to help. But please, these are very tightly controlled extensions here. No matter what, your bubble must remain small and exclusive. These are the same rules that we have had in the past. We have seen in this outbreak COVID being spread between households. Once in a household, everyone is at risk of getting Delta. So, if you break your bubble, know that the consequence may be spreading COVID back into your house, to your family and your loved ones. Please take this rule seriously. It's not until we get to level 2 that you can essentially have contact with others. More businesses can open at level 3, but only in accordance with strict rules. And I do ask businesses that reopen to play their part in reopening safely. Put in place all of the necessary health and safety rules. Make sure you look out for your staff. If any of your workers show up with cold and flu symptoms, please send them to get a COVID test and support them to stay at home until they are well. And please encourage and make time for any staff member not yet vaccinated to get vaccinated. In fact, make time for them to do this week. The best way to keep moving down alert levels and for businesses to stay open is for sick people to stay at home and for everyone to be vaccinated. For everyone else, keep working from home if possible and keep children and young people at home with you where you can. Remember, schools are broadly speaking closed. They should only be going to school if parents must go to work and there's no other option available. You recall that this is the same setting we've always had for level 3. For the most part, schools and other learning centres are closed. In the rare instances where children are in a school environment at level 3, Cabinet today agreed to make face coverings mandatory in all level 3 high schools in all indoor settings such as classrooms and assemblies. This is an added precaution. Again, this is for level 3 high schools. Again, it will be very rare that anyone is in attendance at these schools, but where they are, we have a mask requirement for them. Events and gatherings still cannot happen without except for the extraordinary exception of 10 people being able to gather for a civil union wedding, funeral or tangihanga. Again, that is in extraordinary circumstances. And a reminder, because Delta has changed the rulebook, we have had to change how we manage it. Here is an overview again of those changes. Contactless delivery and pickups can occur, but all staff and customers are legally required to wear a mask for outwardly facing businesses. So when you pick up something in a contactless way, everyone should be wearing a mask. In fact, everyone is strongly encouraged to wear a mask in any indoor setting with people outside your bubble. The latest science tells us Delta spreads very easily, often through the air, so masks make a real difference. I'd encourage all businesses to familiarise yourselves with all the level 3 requirements. Meanwhile, business owners and operators can now access their premises in order to prepare for contactless opening, including to meet the public health requirements. I now have a particular message for those listening who are over 65 and especially in Auckland. For you, level 3 poses a slightly higher degree of risk, and that is why I'm stepping up my level 3 advice for anyone over 65 in Auckland. If you have not yet been vaccinated, please stay at home until you have been. This will give you an extra layer of protection in this outbreak. We have been doing direct outreach to all our over 65s who haven't had their first dose yet in Auckland. That amounts to about 23,000 people. The vast majority of over 65s have been vaccinated, but for the smaller group, we really do want to encourage you to take that next step. Last week, a letter was sent to those over 65s who we had details for. Today, we're commencing an outbound call campaign. Healthline have started calls this afternoon to support our older New Zealanders to be vaccinated. These will average about 8,000 calls a day. If you get a call, Please take the opportunity to ask any questions or raise any concerns. We have people on the end of the line who can answer them for you and help with the booking and support you to be vaccinated. If you have a booking that's a way off in the future, please bring it forward. There are plenty of spaces right now. We've only asked our oldest people specifically to stay at home once before. It was when we didn't have a tool to protect you. It was right at the beginning of lockdown. Now we do have a tool, and I'm asking that you please use it. If staying at home makes you feel anxious or distressed, please reach out. Many pharmacies are doing medication deliveries, and the Student Volunteer Army grocery delivery service can help you access food. Age Concern can be contacted for general advice and support. Their number is 0800 65 2 105. If you just need someone to talk to, and this message is for anyone, please at any time use 1737. Finally, quick reminder on the boundary rules, and then we'll open up. These are tight for a reason. Most people are not permitted to travel. If you have permission to travel regularly, such as for work, you need to have evidence of having a test in the last 7 days. Again, this is for travel over the boundary. The rules are different for people permitted to travel for personal reasons. You must now carry evidence of a negative test result within 72 hours before you travel. There is an exemption process for emergencies through the Ministry of Health, and this is work we've been signalling for some time. My final word. We are not stepping out of level 4 because the job is done, but nor are we moving because we don't think we can achieve the goal of stamping out COVID-19. We are moving because level 3 still provides a cautious approach while we continue to stamp out COVID-19. It means staying in your bubble. It means contactless transactions and keeping your distance. It means we say thank you to Auckland for their tireless work, and we collectively keep going.